Good evening and welcome to the second event in our Asia Pacific Foundation of Canada's online Asia Leaders Speaker Series, titled today, The Economic Impact of COVID-19, Lessons Learned from South Korea's Response. My name is Christine Nakamura, Vice President of the Asia Pacific Foundation of Canada's Toronto office and your host for this evening. While we are meeting today in a global digital space with participants from Asia, Europe, the US, and from coast to coast to coast across Canada, the Asia Pacific Foundation of Canada takes this opportunity to acknowledge that the places Canadians call home are the traditional territories of many First Nations, Métis, and Inuit. Before I call upon our board chair to make welcome and opening remarks, I'd like to bring to everybody's attention a few housekeeping items. This webinar is being recorded, and in the right hand corner of your screen, there's a Q&A box for questions that you'd like to ask. Please use that box to post your questions throughout the event, and we'll do our best to answer them after the presentations, time permitting, of course. Feel free to contact us offline should we run out of time and your questions do not get answered. We'd be happy to respond to you. Should you have any technical difficulties throughout the event, please email events@asiapacific.ca. I repeat, events@asiapacific.ca. And we've scheduled an hour for tonight's event, so hopefully we'll get through in that time frame. I'm now delighted to introduce our board chair and executive advisor international at Deloitte Canada, the Honourable Pierre Pettigrew. Mr. Pettigrew has an extensive background in international relations in both the public and private sectors. Since entering politics, he has held key ministerial appointments over a 10-year period, including Minister of Foreign Affairs, Minister of International Trade, and Minister of International Cooperation, just to name a few. Mr. Pettigrew has traveled extensively and many times to the Asia Pacific region. He served until recently as Canada's Special Envoy for the Canada-European Union Comprehensive Economic and Trade Agreement, or better known as CETA, and is the author of The New Politics of Confidence, a book on globalization and the art of governing. It's my great pleasure to introduce to you the Honourable Pierre Pettigrew. Pierre, over to you.
Thank you. Thank you so much, Christine, and very good evening to everyone. It is a pleasure to welcome you to the second webinar of our online Asia Leaders Speaker Series. In our first session, we hosted Dr. Sawada, Chief Economist at the Asia Development Bank, who shared his insightful projections on the global economic impact of COVID-19. His overview effectively sets the stage for the country-specific sessions that will begin tonight. Although at different stages, progress is being made by nations around the globe in the fight to curb the spread of COVID-19 through social distancing and other containment efforts. Countries in lockdown that are beginning to experience a leveling of the curve are anxious to move forward into a less restrictive lifestyle and, of course, economic recovery. European nations and jurisdictions in the United States and Canada, including major epicenters of the pandemic, have started to ease restrictions on the social distancing and are enabling the reopening of non-essential businesses. In Canada, a number of provinces, including Quebec and Ontario, the two most affected regions in our country, are also lifting restrictions, albeit cautiously, to suit local circumstances and needs. However, reactions to the reopening have been varied, with growing concerns that it may be too early to lift measures. Elementary schools in Quebec, with the exceptions of schools located in Montreal, the epicenter, as we know, reopened yesterday, but the number of returning children has so far been low. And despite special health and safety protocols being implemented by retailers of non-essential businesses, The return of shoppers and consumers has been slow and limited at best, confirming that people are still not confident about returning to pre-pandemic times. Time will tell, essentially, in the next 2 weeks or so, whether actions taken by these jurisdictions were premature. New infections are surfacing in countries and jurisdictions that have been free of new cases for some time. This week, Wuhan reported its first cluster of COVID-19 since lockdown was lifted in the city over a month ago. In South Korea, the focus of today's discussion and the epicenter immediately after China, has earned global acclaim for effectively flattening the curve without comprehensive lockdowns or travel bans, which have characterized many other countries' experiences. However, South Korea may be facing the possibility of a second wave of infections, and this time in Seoul, where the densely populated urban center is home to about 10 million people. Canada is weeks behind South Korea in the evolution of the pandemic, so information shared by Korea will undoubtedly be of great benefit as we go forward. South Korea and Canada are bound by the only bilateral free trade agreement that Canada has with any Asian economy. I am hopeful that cooperation between our countries will lead to excellent outcomes, not only to contain and eradicate this pandemic, but also to mutually benefit our economies. By working collaboratively to find solutions and new ways of doing business in the new normal, we can create new opportunities and inspire innovation among talented scientists, healthcare providers, researchers, and entrepreneurs around the world that should and will lead to a better world. Thank you, and I look forward to the presentations by our Korean experts and the discussion that follows, moderated by our ABLAC chair, Dr. Yoon. Thank you, Christine.
Christine, you need to unmute yourself.
Okay. Thank you. And now, before I hand over the mic to the moderator of today's discussion, I'd like to give a bit of background about Dr. Yoon Song-yi, CEO of NCSoft West, a leading South Korean video game developer, and the current chair of the Asia Pacific Foundation of Canada's Asia Business Leaders Advisory Council. Dr. Yoon will be providing more information about her company, but NCSoft has over 4,000 employees globally and subsidiaries in Europe, Asia, and North America. Some renowned games produced by NCSoft include Lineage, City of Heroes, Guild Wars, to name a few. She is responsible for managing the organization and planning the company's globalization strategy. She has been instrumental in the launch of many of NCSoft's titles in the United States and Europe, and in moving the company towards new initiatives, including the development of the mobile studio in San Mateo, US, and research into new technologies such as artificial intelligence. Dr. Yoon is also President and Global Chief Strategy Officer at NCSoft in Korea, a graduate of Korea Advanced Institute of Science and Technology and PhD recipient from MIT. Dr. Yoon started a career at McKinsey & Company and has held various roles, including Vice President of Communication Intelligence at SK Telecom before joining NCSoft in 2008. She has been recognized by various organizations for her leadership throughout the years, including being named to Wall Street Journal's 50 Women to Watch in 2004. It gives me great pleasure to introduce to you Dr. Yoon Song-yi. Over to you, Song-yi.
Thank you very much for a generous introduction, Christine. So the world is cautiously testing the waters for reopening their economies in the wake of COVID-19. New transmissions of the virus are widely variable in countries around the world. South Korea, along with a select few other countries, are in a situation where local transmission is close to being eliminated, and where the vigilance has begun to return to work. In Korea, most companies have started bringing staff back to work in staggered schedules, such as for 4 days a week, in order to reduce employee density in the workplace while maintaining productivity. At NCSoft, we did so in relation to which schedules worked best for the individual employee or the business unit they belong to, and or their family needs. This also meant scrutinizing our office spaces and determining new seating layouts, which can be effective at maintaining healthy social distancing. Still, we're continuously working with various operational NCSoft committees to ensure we're meeting our employee expectations in terms of safety in the workplace. We offer testing and also have established several different protocols and can move quickly, especially if someone needs to go into quarantine. While we spent more than 70 days under quarantine in South Korea, the result is that we have practically ceased local transmission. We intended to do everything in our power to ensure that our office space stays safe for employees. Management conversations continue to focus on sharing recommendations, what is working, and how we must remain diligently committed to transparency in communicating with our employees, whether it is about testing, monitoring, or other facets that could minimize transmission of the virus. Eradicating COVID-19 is an enormous worldwide challenge, which requires leaders across the planet to share information about how to help protect our global community. So today, our panelists will talk to you about how South Korea worked with public and private sectors, government health officials, and global health guidance from the WHO to minimize the human and economic tolls this virus has taken. During the panel, we'll discuss the lessons we can learn from South Korea's experiences dealing with COVID-19, and most importantly, how it can massively increase the amount of reliable data points available to health and government officials in order to make informed decisions. The panel will discuss how through extensive health testing, followed by contact tracing to help minimize and isolate further exposure. We'll learn how crucial it is for the citizens to play their parts and to cooperate for the successful execution of public health and economic policy. We can follow the guidance of government and health officials to focus on eliminating COVID-19 and minimizing further disruptions to our collective economies. Now, I'd like to turn it over to our presenters today, Dr. Kwon-Soon Man and Dr. Choi Byung-il. The first speaker will be Dr. Kwon-Soon Man, professor and former dean of the School of Public Health at Seoul National University. He also serves as president of Korea Health Economic Association and was a former president of the Korean Society of Gerontology. Dr. Kwon, please.
Thank you. Many thanks for inviting me. I'm very honored to join this webinar. I'm a health economist by background, but I spent my entire professional career at the School of Public Health, not the economics department. I also collaborated a lot with Canadian scholars, especially like 10 or 15 years ago when Christine was at the Canadian Embassy in Korea. She organized a lot of exchanges between Korean and Canadian academics. And they were quite fruitful exchanges between the two countries in academia, especially in the area of social policy at that time. So after that, I also had a 1 semester sabbatical leave at the Department of Political Science at the U of Toronto. And my son, he really enjoyed attending the primary school there. Actually, he did not want to come back, but but now he's almost graduating from the university now. So time flies, basically. And also a few years ago, I got special leave of absence from my university, and I worked at the Asian Development Bank as the chief of health sector group, so covering all health programs in the Asian countries at that time. So far, Korea has been managing this COVID-19 reasonably well. You know, the game is not over, but so far quite effective. And I'd like to share with you what are the major factors for the Koreans' rather effective response to COVID-19. I think one of the most important factor is the early, quick response to this crisis, because it all depends on the capacity of healthcare system. But in the healthcare system, you have some kind of a public health and infectious disease components. And another very important component is a treatment component, like hospitals. But for this type of COVID-19 infectious disease, if it didn't do a good job in the first part of the system, so I mean, if you failed those control of epidemics surveillance, then there's a huge patients. No healthcare system, I'm saying no healthcare system can handle those big number of patients. So the most cost-effective approach is respond early. So that's the meaning of flatten the epidemiological curve. So reduce the number of confirmed cases early and isolate them so that we can avoid overburdening the whole hospital systems. So that's the key. Okay? So the Korea strategy is something like a 3T: test, trace, and treatment. Of course, we can also say isolation. So these are very important components. Especially this COVID-19, one of the unique characteristics is that even people without symptoms, they can infect others. So in that sense, early testing is quite effective. So by early testing, people can know, especially young people, even if they are infected, they have no symptoms, but they can infect others. So massive scale testing, and then a very aggressive contact tracing and isolation of the infected people. And then also we should also treat people who are infected. So all those components are quite important. And Korea was quite successful in the early interventions, very massive testing. Probably you already heard about like a drive-through testing. This is quite innovative idea. Okay, so by drive-through testing, you can increase the number of testing. Plus, more importantly, you can avoid the infection of healthcare providers and hospitals. Because if a COVID-19 positive person visited the hospital without knowing that he or she is being infected, then he can infect other healthcare workers and he can infect the whole facility. So drive-through testing can avoid that type of potential infections. But this type of testing and contact tracing, it might be a bit controversial, especially in the Western, European or Canadian, North American continent, because of the potential concern on privacy. I can understand that. So this contact tracing should be based on a very strong legal foundation. So Korea has a law which allows that this type of contact tracing, and then this information is kept for 2 weeks, and after 2 weeks, it should be discarded. Okay. Next second issue is the transparency and the communication, because it's very important that the government should lead this whole process, and the political leadership combined with technical or scientific support. So each day, in the typical briefing in Korea is a briefing by the Ministry of Health and Welfare, but also briefing by the Director General of the Korean Center for Disease Control. So there should be a combination of political leadership and technical, scientific support. Then this type of briefing can give a clear, can get the strong support by the public, and public can trust the government. Okay, and this type of trust, transparency, accountability is very important, because, as you know, one of the most effective measures are social distancing, personal hygiene, wearing a face mask. So if the general public do not trust the government, do not trust the government message, this type of social distancing, personal hygiene masks doesn't work. And also, this transparency contributes to the collaboration between public and private sector, and also the collaboration between central and local government, because in most cases, this type of infectious disease and public health are governed by local or district government. But COVID-19 is a new infectious disease. So in most cases, local government do not have enough technical knowledge how to cope with this new disease. So in that sense, I think the collaboration, technical lead by the central government, but effectively supported by local level implementation, that is very important. And also in the case of Korea, there's probably you've heard about the huge outbreak of in a big church in a Daegu Gyeongbuk area. So the whole region at that time, there are shortage of beds for patients. So in that case, there should be effective collaboration across different provinces and different districts to allocate the beds and allocate the patients. So that type of collaboration is also important. Then how Korea, what is the major factor that Korean government or Korean people rapidly responded to this COVID-19? I think there's a very important policy learning component in Korea. About 5 years ago, probably you've heard about MERS, is a Middle East respiratory syndrome. At that time, to be honest, many, including myself, like an expert in health policy or healthcare in Korea, we feel very ashamed. How come we did not cope with this MERS? Because at that time, Korea showed a largest mortality outside of Middle East from MERS. So we all feel very much ashamed of this experience. But there's a good policy learning after MERS, such that government strengthened the Korea Center for Disease Control a lot. And also, we revised the law, infectious disease control and prevention law, such that they gave a foundation for contact tracing. Because before MERS, we didn't have a legal basis for contact tracing. We didn't have a legal basis for information disclosure. But after MERS, the new revision, new law allows the government to be able to trace contacts very aggressively and show this information, send a text message to the public, such that if you if you have been in the neighborhood during that specific time with this infected person, please come to the testing center and get tested. So this type of legal basis is quite important for contact tracing and also text. I mean, sending messages, clear messages to the public, and also there is a component of learning by doing, because this is a new infectious disease. So we should be ready to learn from everyday learning, basically. So one example is that in the Daegu Gyeongbuk area, initially all infected confirmed cases were hospitalized. Then you can see it was very clear that we don't have enough hospital beds. So government uses a triage system. Triage system means we check the severity level of the patients extensively, such that, okay, if you are very severe, you will be in a hospital. If you are a mild patient, you don't go to hospital, but you stay in a so-called living treatment center. It's not a hospital, but like a formal or residential facilities, but temporarily converted into like a treatment center. But there are only just a small number of doctors and nurses, so they stay there, mild patients. So this type of triage and patient allocation system was introduced. And also another very important component is that telemedicine. Because of due to the opposition of the Korean Medical Association, in Korea still no telemedicine allowed. But during the SARS, you can imagine, first there are many people who cannot travel to visit doctors, especially old people. They feel they are afraid of being infected, so they do not want to go out. And also doctors or offices, doctors, they were worried about this being infected by a visiting patient. So government and the medical association agreed that, okay, telemedicine is temporarily allowed for this COVID-19 crisis. I hope this will be the beginning of the deregulation of telemedicine in Korea, although Korean Medical Association is still strong stumbling block for this innovation. So I'd like to emphasize this, like a policy learning or experiential learning in the process of the response to COVID-19. My last point is that, in many countries around the world, we have a vulnerable population like elderly. There are many. Mortality is much higher for older people than younger people. So how to protect these old people is a major challenge for our society. How to protect the poor people, how to protect the workers in small business, how to protect the migrant workers. They live in a very, vulnerable environment. So this protection of the vulnerable population is a major issue for many countries, including Korea, I guess. My final point, our challenges. Korea has been quite successful in management of COVID, and people voluntarily participated very well in this government campaign. But the next question is how far, how long can you go like this? At some point, we already started to relax some of the restrictions, but how fast should we do this? Because I'm a bit worried that currently there are too strong role of medical profession. Okay, how the government measures are driven by medical concern, not enough consideration on the social economic benefits and costs. Okay, because although restriction can help preventing the spread or managing this COVID-19, but restrictions means that there are more negative impacts on the society. So for me now, I'm really concerned about what is the best way of making a societal level decision making with a good consideration of not only the medical cost and benefits, but also broader socioeconomic benefits and cost. How to make reasonable decisions out of this COVID situation. Thank you. Now my presentation is over, so over to Professor Choi.
Go ahead, Dr. Che.
Thank you. Well, first of all, I'd like to express my appreciation and sense of privilege to the host, Asia Pacific Foundation of Canada. I've been working with Canada for a long time. Even before I became founding faculty of GSIS EWA in 1997, I was a Korean trade negotiator. So I worked along with my Canadian colleague in APEC and also WTO Basic Telecommunications. I believe I play such a role in enhancing global telecommunications society so that we can go through digital transformations. Also, ever since I become university professor, I work with Canada Embassy in Seoul. Maybe Christine was also part of that effort to smartly resolve trade dispute, mainly Korean-Canada beef dispute. So I think it is a living testimony. Canada and Korea's country striving on international trade investment. So I'll focus on that economic aspect of COVID-19 this evening. Well, I think Dr. Kwon, he emphasized Korea was learning from mistake, like 2015 MERS pandemic, and whole society was in chaos and so much, the infodemics. So they realized importance of containing, spreading some rumors and false fake news. So they're learning from mistake and come up with more resilient system, medical system. But unfortunately, when it comes to economic side, I tend to believe Korea hasn't learned effectively enough because Korea was going through 1997 Asian financial crisis and also 2008 global financial crisis. And in those two crises, Korea was able to overcome those crises. But every time, somehow, Korea's very vulnerable spot was not frontally challenged. For instance, the weakest spot of Korean society right now is about 6 million self-employed small business. I think they are very much economically disadvantageous and vulnerable part of society. They're always the one who are hit hardest whenever something like this happens. So I think immediate concern and primary goal of Korean government was to make sure their life is going to be still stay afloat. But it is getting difficult because all this supply shock, demand shock, and social distancing, and that is biggest concern. But nonetheless, Korea was able to overcome those two biggest crises before. It is mainly because Korea was able to maintain production capacity in leading manufacturing sectors, ranging from automobile, petrochemical, steels, IT, and so on and so forth. But this time is different because Korea was heavily invested in China in those leading sectors. And despite several warning signals, including people like me, somehow Korean business, they continue to focus and invest on increase their exposure to China. And this corona pandemic exposed China risk bears. So, a lot of damage is done. So I think what government tried to do is that they try to make sure this, backbone of Korean manufacturing business stay alive. For instance, automobile and shipbuildings and steels and all these petrochemicals. They're going through a double challenge. Not just the China being epicenter for this crisis, repercussion from China, because oil market is now going through unprecedented, very abnormal situations. Korea is one of the leading countries in petrochemical. They're suffering a lot. So while Korea was reasonably, managed quite well in containing and mitigating pandemic crisis in medical perspective, but when it comes to economy, I think we are very early in the game and shock is about to be recognized. So we're getting numbers like, this morning, Korean Statistics Office, they released job data. According to that, in April alone, about 480 million jobs disappeared and no new jobs added. So which means when new college graduates are coming out of their schools this summer, and obviously they're not given any effective job. So what government tried to do was, like any government is doing, including Canadian government, first of all, the short-term immediate measure is that they have to make sure that there will be no financial panic and no bank runs. And so, as I said, these small and medium-sized industry is going to be offloaded. And Bank of Korea, they're busy providing liquidity, and they cut down interest rate from 1.25% to 0.75%. So very sharp decrease, and they're willing to cut more if it is needed. Also to provide stability in financial market, because every time crisis exploding, Korean exchange market is showing dramatic instability. So Korea was effectively able to create currency swap agreement with US Fed. So Korea secured about $60 billion, the US dollars. So they're able to stabilize market. But as I said, this is still early in the game. And when we are heading into June and July and summers, industry people are telling me that all this shock is going to be doubled and tripled and so on and so forth. So Korean government, they are very conscious about what they have to do in if they believe this is sort of long-term game. I'm using the analysis from baseball because some Korean baseball has been Cinderella attention of global community. Baseball is being played up to 9 innings, right? And I tend to believe we are still in something like the third innings, the bottom of third innings, so very early in the game. So government, not only they are focusing on to provide some lifeline to those marginalized people and SME. At the same time, I think that they are having some long-term plan that is make sure this digital innovation is going to be a new engine of the Korean economic growth. So they talk about smart health. This is a similar concept but different. Something Dr. Kwon mentioned, telemedicine, because of Korea's all this well-prepared IT infrastructure. But somehow they were not able to overcome some, so much complicated issue in medical society. Telemedicine was only a remote possibility. But I want to see this telemedicine is really paving the way, take advantage of this COVID-19 crisis. They talk about smart factory and also smart city. So digital innovation is one big policy platform. Korea is going through some midterm and long term beyond this corona pandemic. Another thing is government is considering how we can safeguard against some recurrence of this health crisis. So they're conscious about how they can reduce too much dependence of Chinese part of the global assembly line, global value chain. So business U-turn or reshoring is under policy discussions, but I don't think business side is going to follow with that call by government, because Korean government already they tightened labor regulation. So possibilities, more or less, business will seek for some other places outside of China. It may be Vietnam, India, even Canada, some other country. So cost consideration one thing, but security concern and safety concern is getting riding high. And another thing is Korean government and also business is recognizing outside external environments getting more hostile to Korean export. So country after country, they're racing to build up protectionist barriers. For instance, when it comes to shipbuildings and the steel industry, there are so many protectionist measures like anti-dumping and safeguard measures. So I think this is something Korea alone cannot tackle. So maybe the Canada and Korea, we can act together and fight together to resist this rise of protectionism. So I will stop here. Thank you.
Okay, thank you so much, Dr. Che and Dr. Kwon, for sharing your valuable insights. I hope it will lead to much needed global collaboration and ultimate eradication of our invisible enemy. So we'll start with the Q&As, and please be reminded that you can post your questions using the Q&A function in the top right corner. Then we'll take the questions and ask to Dr. Che and Dr. Kwon. So I'll start with a couple of questions, starting with to Dr. Kwon, please. So listening to the story of how South Korea coped with COVID-19, it reaffirms the fact that the public-private sector collaboration, as well as the full cooperation of the citizens, are critical for the success of the policy. And you also mentioned that it'll be difficult, but it'll be difficult to adopt such measures in Western countries due to cultural differences between Eastern and Western cultures. And what are the ways for inducing such cooperation in other countries when there aren't already such cultural basis and trust for the needed collaboration for the success of the public health policy, and how other countries can quickly adopt practices against its own legal and cultural momentum or biases?
Okay. I'm not suggesting actually that Western societies, Europe or North American, cannot adopt this, but what I'm saying is that you face difficulty adopt this because, but it should all based on social consensus. Because in a Korean context, but it's not just a Korea, but I found recently, I'm collaborating with East Asian countries like Hong Kong, Singapore. I found many East Asian countries are open to this type of contact tracing. People support it, but I'm not sure whether it can be supported by the public in other countries. So I'm emphasizing that the social consensus is very important. That's my point. Other one is the public-private partnership. You're right. I fully agree that the collaboration between public and private sector is very important. In the experience of Korea, the collaboration between public and private hospitals was very important because we don't have, if you rely only on public hospitals, we don't have enough bed capacity to treat the patient. So there should be a collaboration between public and private in the health service provision. But more importantly, in this context of COVID-19 in Korea, there's a huge collaboration between the government and the private sector in the producers, in the test kits, and also ICT, telecommunications, because all the important information should be provided by telephone companies and also credit cards companies as well. So the collaboration between that sector. So that's why we call it multi-sectoral approach. It's not just health, but health and other sectors, public and private, and also central and local government. There's all should be an effective collaboration. Getting back to the producers of test kit, even in the late January, at that time, there was less than 5 confirmed cases in Korea, but KCDC at that time already had a meeting with a few producers of test kits. And then KCDC encouraged them, please them to consider producing this, and government and gave a clear signal that government is willing to provide a rapid approval. So that's why as early mid-February, we had several producers that produced test kits in enough quantity. So this type of, this is another very good example of public-private partnership in the test kit production. Over.
Thank you. So going back to that, adopting kind of implementing legal basis for aggressive contact tracing and isolating. So you mentioned that that Korea implemented legal basis back in 2015 after the outbreak of MERS. Was there any reactions from Korean citizens to implementation of such legal basis?
Well, actually, talking from the result, I mean, outcomes that the law was passed, we can imagine that the opposition was not very high, right? That's why it succeeded in the laws being passed. So, but still, some legal scholars, you can imagine that some expert in the law, they express concerns over this type of law. But otherwise, I think there is a very broad support from the public for this type of using information from mobile phone, or using information from credit card, or using the information from CCTVs to trace contact is broadly supported in Korea. Sometimes some people, but recently there is an issue of what is it? There's a band on your wrist for tracking those who are in quarantine. So initially some discussions over whether we should use this type of band. I don't know what is the right wristband, a band on this side, to use it to trace the quarantine case or not. And then there's a general public consensus that that's too much. But if there is a case who violate the quarantine, that means if you are supposed to be in quarantine but you got out of the quarantine, then you'll get this band. So and the band is closely monitored. So that type of still, I mean, broader consensus, and for some details, I think people think that that's too much. But other than this, Korea is a very strict privacy law. Sometimes we researchers, we are complaining the too strict privacy law is a barrier for our research because many information is blocked. So I think, but still, this is ongoing process. And then, although it is based on the broad support, to some extent, like recently, there is an Itaewon small outbreak. I think you've heard about it. And in the Itaewon outbreak, government asked the mobile phone companies to submit the data on the mobile phone exchanges in that area during that time. So some people expressed that this is too much. Okay. So, but overall, I think it's based on Korean people support this type of contact tracing. Over.
Thank you. Yes.
Can I jump in to say something on this issue?
Sure. Yes, please.
Yeah, I think in Korean society, we have very interesting asymmetry, people's attitude toward about privacy. As Dr. Kwon precisely described, when it comes to health issues, I think there's a broad consensus in society. Government can be, staggering, intervening, as long as it didn't create too much, the hassles. But when it comes to commercial application of some data, big data, I think, as I mentioned, despite all this infrastructure, all this data available, but when it comes to fintech, China is flying on fintech, but Korea is lagging behind not because technology is lacking, because the people's perception and politics perceptions, this data should not be utilized for commercial business. So it's only quite recent time politicians was able to recognize, well, if we cannot act right now, it may be too late, may be behind this. So we have to admit in Korea society, there's a privacy concern, but when it comes to health issues, I think people are willing to follow the cue from the trusted, the expert.
Right. Thank you. So, Professor Choi, I have another follow-up question about, you mentioned in your presentation that the small, medium-sized companies and the vulnerable entities will suffer the most from this pandemic. And if you look at how other countries are coping with this, particularly the US, has been able to reduce direct impact while it's suffering the most from the pandemic among the developed economies. And it's by massive injection of cash into the system, leveraging the US dollar's position as a national currency. On the other hand, countries like Korea must seriously consider the consequences and resulting national debt level when it uses expansionary fiscal policy to deal with virus-fueled economic depression. How should we approach the increased debt, and what could the implications be for the future?
Well, when people are talking about Korean government debt, numbers something approaching 40%, even though there's no golden rule, the beyond 40% is terrible and below is okay. But as a country, which is always, at the mercy of external volatility, we have experienced whenever something bad happens with this magnitude, like 1997 and 2008. And right now, the COVID pandemic is only, somehow related to 1918 and Spanish influenza plus 1930s Great Depressions. So when you realize this is going to be, Korea is at the beginning of, early part of tunnel, then you have to make sure you have, sufficient cushions and reservoirs. So while Korea is still, below 40% government debt, but when you account Korea's massive public sectors, like a state-owned enterprise and public enterprise, number is going to be much more increased. So that is a giving cue to, the technocrat. Well, we shouldn't be that much lavish, because US is a country, whenever they like, they can print money. The only country in the world who have that, the levity. So somehow what is exercised by US shouldn't be followed that rigorously. But having said that, the government, the politicians, all experts, they realize that this time is different, and we have to take whatever measure necessary, because psychology is very important. People tend to believe, well, if this is going to be long tunnel, then despite cash is provided through helicopters, people are not going to travel, maybe some online shopping, but they're limited consumption activities. Well, that may be, prelude to lost decade of Japan, which they experienced, those 2 decades. So I think, there's linkage. Too much debt is maybe dangerous in dealing with next and third outbreak of this, pandemic and crisis. But if you cannot deal with those vulnerable sectors immediately, then, it may be too late. So always you have to make a very tough balancing act.
Right. So, and also, Professor Che, there is a looming risk of a second wave of outbreak. And from the economic shock perspective, how do you think the second wave of outbreak will be differently affecting the economy compared to the initial wave of outbreak?
Well, if second break is really realized, I think it is making problem even worse, because earlier in crisis, there was people in the market who talk about V-shaped recovery. That is, the once treatment is discovered, then we can get out of this crisis as if nothing happened. But it looks like treatment maybe coming on the horizon, but maybe delayed. But in the meantime, too much damage done, especially Korea's major basis of manufacturing sectors, too much shattered. For instance, automobile sectors. Korea has been one of leading sectors of automobile sector, including autos and auto parts. But that is all in shambles right now, and they're not getting orders. And which means, they have to forced to send all those workers to home. And because of, tight labor regulations, they still on payroll. So labor market is not flexible enough to absorb the shock, and which means from management side, they are indebted too much. And if second outbreak is coming, then it may be, unbearable. So, I think what is happening, stock market is not proper indication, because stock market looks like a bounce to, to the levels, not the previous peak level, but somehow stock market showed very rapid, the bounce back. But when it comes to real sector shock, I think, we are very early stage of game. If a second outbreak, third outbreak is coming, then this is going to be too much to bear.
But I think if you allow me to add, there's some uncertainty about the impact of this second wave. I think I'm not very pessimistic because currently this is the kind of unprecedented experience. So I feel like people are shocked, or people are scared, but too much. So we should keep vigilant. But we should not be scared, because if people are too much scared, there's the huge demand shock. So in early February in Korea, when there are only like 10, 20, below 50 total cases, people did not want to go to the restaurant where a confirmed case visited. So this lasts like a few weeks. So that restaurant is devastated. Now people feel that, okay, even if a confirmed case is visited that restaurant, but that will be sanitized, and we can visit that restaurant right next day. So I think, as I'm saying, we should keep vigilant, but being scared is not a good thing, especially for the economy. So I hope that I'm not saying people should be relaxed, but over the years after this experience, when we get the second wave, people are not too much shocked, and they are still willing to, go to the shopping and restaurant with face masks. So I think it's a bit uncertainty which direction we would go over.
Yeah, but what I'm trying to telling right now is, well, when it comes to domestic market, when people are getting more, the confident, then things around. Korea is, the trading nations. More than 70% of trade is out of GDP is related to international trade. Sure. And what I'm saying is the global value chain is so much disrupted. Not only China, India, and a lot of Eastern European countries. So it will take a lot of time to get back to normal. And also personally, I don't believe they'll get back to previous level, even if there'll be no second outbreak. Mm-hmm. So on top of that, if second and third outbreak will come, then it is going to be too much to bear. That's what I'm saying.
Thank you. I think we have time for one more question to Professor Kwon. I think one of the acute interest from the audience is about reopening the school, because we are keenly interested in keeping children safe. But opening school is also have a direct impact on when parents can go back to work. And so is there anything that the Korean policymakers adopted or managed in regard to reopening the school and childcare that we can learn from?
I think that part, I heavily criticize the government because it's wrong that we still keep the school closed. What I'm suggesting is that we should be a targeted approach, such that, sorry to say this, but we should close the bars. We should have closed the bars before, but government opened it. That's wrong, because we all know that the probability of infection in packed young people packed in bars and nightclubs, that's very high probability of infection. So we should have closed it for a while. But the schools, I think we should open the school as early as possible, because there's a huge impact on the school, students' performance. And also, unfortunately, government in Korea, government decision on school closing and opening is not closely related or combined with the decision on the caregiver's perspective, such that, if we should close the school, we should be ready and we should provide all possible measures to support the family who, in terms of how to take care of the student, the children at home. But unfortunately, that type of arrangement, although we have an emergency care process, but still it's not enough. So it's very unfortunate that the decision on the school closure is not well coordinated with the decision on caregiving. So still, some mothers, they should go to work, but the children stay home. So this kind of uncoordinated decision is wrong, I have to say. Is it clear? Or so I think that we should reopen the school as early as possible, but close the bar.
Right. Thank you. I think we are still kind of all in this and learning from mistakes and various tries. Thank you again, Dr. Che and Dr. Kwon, for sharing your very valuable insights. And I also greatly appreciate the opportunity to share the lessons learned to Asia Pacific Foundation of Canada. Now I'll turn it over to Stuart Beck, President and CEO of Asia Pacific Foundation of Canada.
Well, thank you very much, Sung-Yu. I appreciate greatly you moderating this event, and thanks very much to Dr. Kwon and Dr. Che for, I think, a really fabulous presentation. You've given us a lot to think about, and it's very hard to summarize in a couple of minutes all the wonderful thoughts that you came up with. But there's a couple of things, Dr. Kwon, like you, I'm a baseball fan, and we are in the early innings of this horrible event that we're going through, we need to work together. And I think part of what came out of both your presentations is the need to deal with a global pandemic in a global way. And unfortunately, we see bifurcations and different things happening at this point in time. And I think there's a role for middle powers like Canada and Korea to help bring people together to kind of deal with the crisis as we're facing it. A couple of points that came out, Dr. Che, I think in particular, the issue around public trust is so fundamental, and the role of government in developing that public trust is so key. I can talk to the experience here in British Columbia, where we've done a very good job, I think, of bringing that plank, bending the curve, and a lot of that is a result of the trust that we have in Bonnie Henry, who is our public health officer, and people have been following what she's had to say. And I think that's done a good job. We've had other reasons why I think we're a little bit ahead of the curve in that sense, but that in particular, I think, is a key thing. The second thing that came out of your presentation, Dr. Kwon, that I think was really important is the role of digital innovation and how we can use this as a great opportunity to build on that. And I'd like to say that, from a Canadian perspective, we're investing heavily in that particular space, and I think we have something to offer globally. And I hope working together with Korea, we can come up with some solutions to some of the problems around contact tracing and other areas. Machine learning, of course, we're seeing in Canada as being a world leader in that particular area. And I think the last thing I'd just like to, the point I'd like to make is the conversation around global value chains, and some of the work that we're doing at the foundation is focused on that. But the importance of understanding what that impact will be on small and medium-sized enterprise in particular, and the reshoring aspects, but also just in general, we can't totally disrupt that, because ultimately the world has become so globalized so quickly. Trying to undo that overnight is going to be a real impossibility. So again, I'd just like to offer my thanks to all three of you for a great presentation, and to the Asia Pacific Foundation team for making a seamless presentation today and dealing with some of the technical challenges we had last time. Today, I'd like to say thank you very much, and we look forward to our next one, which will be coming up in the not too distant future. So please pay attention to that, and thank you all for joining us today.